Dear reviewer, good evening and welcome to Spotlight. With me tonight, Dr. Kumar. Dr. Kumar is running for U.S. Congressman, the 11th District. Dr. Kumar, welcome to MEA TV.
Wally, thank you so much for having me here.
Thank you.
It's an honor. It really is an honor.
Thank you very much. Before we go to politics and you're running for a candidate for U.S. Congressman, tell me about Dr. Kumar. Are you profession as a doctor? And when did you come to United States and how you grow up? Did you grow up in Michigan and all that?
You know, I'm a doctor, genuine real doctor.
Okay.
And I'm a urologist. And I practice out of Troy Beaumont, Crittenton Hospital, you know, the northern Oakland County.
Yes.
And I am from India. I grew up in Mumbai, Bombay, India.
Okay.
And I did my medical school there. And after that, I did.
What year you came to United States?
I came to United States in 1984.
I see.
Yes.
Yeah. Yeah. And how you got involved in politics, and you know, as a doctor, you are busy saving people, honestly, with many operations. And I heard a lot of good things about your practice, honestly.
Well, thank you very much. You know, I've been saving people's lives, as you mentioned, for the last 30 years. And then I realized that there is more to be given to our community.
Yes.
Because, you know, as we get older, we get so much experience.
Absolutely.
We know what is good for our children and for our grandchildren. And then I felt that I have so much knowledge, especially in healthcare and education.
Yes.
And that would give me something to give back to society.
Great.
Because, you know, right now, the favorability of Congress is less than 20%.
Yes, yes. We have the miserable people in Washington.
And so what they say is the definition of insanity is you do the same thing over and over again and you expect different results, right?
That's right, yeah. But it's the same result, though.
Yes.
Yes.
So we have to change that.
Absolutely.
So you and me have to decide to say, okay, we're happy doing what we do. We're doing a good job. But we can do better because policy ultimately determines the future.
True. And Dr. Kumar, I want to shade to the ethnic minority. If you look at Michigan, for example, it's multi-part of many ethnic minority.
Yes.
Over 30% in Michigan is ethnic minority. And honestly, they involve in a political system, economic system, social system, become part of the society and contribute so much. And now with you, not just contributing as a medical doctor, but contributing as serving the people of your district. And honestly, as somebody with ethnic background to come and involve and do all that contribution, honestly, this is an honor to all of us. An honor to all of us.
Well, you know, the honor is mine to be able to serve. And our country is a beautiful country.
Absolutely.
You know, it has been founded on fundamentals of equality. And we as immigrants, when we come in, we have the ability to have the equality.
Yes.
But we need to be represented.
Sure.
Because we are a republic.
And that's what's missing. And that's what's missing, honestly. We are involved. We are involved in every aspect of the life. But we have to get involved in a political system.
Yes.
And honestly, if we want to make change, we have to get involved.
Yes.
We cannot just talk and demand things without getting involvement. And you are a very good example of that.
Well,
tell me, because you are a doctor, if you, in your campaign now, what's the health issue is concern you? And what do you want to change toward the health issue?
Excellent question, Wally, because right now, healthcare is right in my field.
Yes.
The one important thing that we need to change is prescription medicines for our seniors.
Okay.
You know, I'm a urologist. I have a number of senior patients. And when I write a prescription for them, they go home, come back in a couple of weeks, they tell me, Dr. Kumar, I can either have food to eat or I can have pills because they cost $300-400 a month.
Wow.
A lot of them are unable to buy that.
Yes.
So what it tells me is that we're really not providing health care for our seniors. We are providing diagnosis because we're really not treating them.
That's right. Yes.
So we need to change that. What I would like to see is that the seniors get their prescription medications for free.
I see.
And there is money in healthcare. It's not like we have to now get more debt.
Is that part of the Obamacare is not covering that?
Correct. Medicare, Obamacare is not covering the seniors for their prescription medications.
I see. And the senior is very important
Yes.
section of our society. I
Yes.
mean, you know,
And it's
they
a-
contribute. They work so hard. We have to treat them good when they get old and need us.
Yes.
Yeah.
That's the promise we made to them.
Absolutely.
And it's
Yeah.
not just a promise. They paid into the system when they were young.
Absolutely. Yeah.
So if we don't cover their health, we are really not doing them justice.
I see.
The other thing that is about healthcare,
Sure, go ahead.
which really bothers me and it affects all of us,
Uh huh.
is the high deductibles.
Yes.
My patients have $3,000, $5,000, $10,000
Absolutely.
deductible.
Yeah. The premium is low, but the deductible is so high.
And the premium is also not even that low.
Yeah.
You know,
So how are we going to do about? What are you going to do about this?
cap it.
Yeah.
We'll have to have the insurances cap it.
Mm-hmm.
And there are ways how the insurance companies can work so that still they're not insolvent.
I see.
But that's where I come in. I can say, okay, look, we don't need this coverage, we don't need that coverage. A person who is 60, 70 years old does not need coverage for you know, a vasectomy, for example.
Absolutely. Yeah. Yeah.
It's just like our car, right?
Mm-hmm.
You can choose what coverage you want and
Sure.
what is necessary for you.
Absolutely. Yeah.
So those things we can do to cover our people without such high deductibles.
Yeah.
Because you know what happens, Wally?
Yes.
You will have a person who comes again with some problem, and we say, okay, you go get a CAT scan, or you go get a MRI or whatever, or get a procedure done to find out what is wrong with you. But the deductibles are so high, they disappear.
They don't do it.
They don't do it.
Yeah.
And then they come back in 6 months
And it's
with a
worse.
major problem.
With worse.
With
Yeah.
worse.
Yeah.
So that's the other things we
Well,
need.
that's a great idea, and
Yes.
that will save us a lot of our especially the senior citizen and all that.
Yes.
A lot of you know, preventing before it happened. A lot of
Yes.
things.
Yes.
Dr. Kumar, tell me about your involvement. I believe I heard it from you that you met the Pope.
Oh, yes.
And your relation with the Chaldean community are so strong, honestly. I mean, you hold same passion that
Oh,
the Chaldean
yes.
community have. Tell me more about
Oh, I
yourself
love to
then.
tell you about
Sure.
it. You know, I was baptized Catholic in India. Okay. I went to Catholic school, St. Andrews, and then I went to Catholic college, St. Xavier's.
Yes.
And I represented my school. Pope Paul VI had come to India for the Eucharistic Congress.
Okay.
And I represented my school to give him a gift.
Wow.
So I was, you know, I didn't even realize how blessed I was. I was a kid.
Uh-huh.
And so that's where I was blessed with meeting the Pope. And it's a fantastic feeling.
That's nice.
And so ever since then, I hold it to my heart. But another important thing about growing up Catholic is, you know, I used to be involved in doing novenas at St. Michael's Church in India.
Wow.
And every Wednesday, if we did the novenas,
Mm-hmm.
Mother Mary blessed us. And so I
Yes.
did that, and it was a
That's
good
nice.
faith.
That's nice.
Yeah.
That's why you're blessed.
Yes, I am.
Thank
But
you.
also let me
Yeah.
tell you how
Yes.
it's important to know with the Chaldean community.
Yes, I've seen you everywhere. Every event in the community and all that. Dr. Kumar is there talking to member of the community, and you
Yes.
know, tell me about your relation with this community.
Well, I have been to Iraq in
Oh, you've been to Iraq?
1979.
Wow.
Mhm.
Yeah.
A friend of mine used to work there in one of the companies as a doctor.
Uh-huh.
And so I went to meet him. I kind of substituted for him for a few weeks.
Which
and-
part of Iraq?
You know, it's the western part of Iraq on the border of Syria.
Oh, Al-Anbar, Ramadi, and
Yes,
yeah,
a place
Fallujah and
called
yeah.
Al-Qaim. I don't know. if
Al-Qam.
you-
That's right. Yeah, that's where you know.
Yes.
Yeah. Mhm.
And then I went all over. I went to Basra, I went
Wow.
to Kirkuk, Mosul, and Ramadi and Baghdad.
I see.
And so I traveled extensively.
Well, that's
And
great.
the people were so happy at that time. 1979 was a great year.
Absolutely.
And people were getting educated, people had pride.
Yes.
When I saw the Iraqi people, it was like, okay, this is a proud community.
That's right.
And
Yeah.
I enjoyed it.
Yeah.
So
But you have a relation with the Chaldean community here. You know,
Yeah.
I mean, I seen you in a lot of events, and you know, a lot of the Chaldean member, they are a friend of yours.
Absolutely,
Yeah, yeah.
absolutely.
Yeah.
You know, having gone to Iraq,
Yeah.
you know, it's like this, Wally. If I come to your house and have dinner with you, guess what happens?
We become
We
close.
become
Yeah.
closer.
Absolutely.
And so, having gone to
Yes.
Iraq,
Uh-huh.
it just made me feel so much closer to your community. And
Great.
there is a very nice community, the Chaldean community here.
Thank you. The
I
whole
have-
Middle Eastern community.
the
you
whole
know.
Middle Eastern,
Yeah,
you know.
absolutely, yeah.
And you know what else connects us
Yes.
together?
Uh-huh.
Bollywood.
Hollywood.
Bollywood.
Oh, Bollywood.
Yes.
Yeah.
Because whenever
Yes.
I would go
Mm-hmm.
to like in Iraq, and
Yes.
I've traveled extensively.
Yes.
I've been to Jordan,
Yeah.
I've been to Syria, and people would come up and say Raj Kapoor because they had seen the Hindi movies.
That's right, yeah.
Yeah.
Yeah, we
So-
put some Indian video clips too here.
Oh, really?
Yeah.
So there is a lot of connection that I do have with the community,
That's
and it's
great.
wonderful. You're wonderful people, and there is a lot of historic, connections.
Absolutely. And
Yeah.
Dr. Kumar, all the ethnic minority, they face the same issue.
Yes.
They believe in a family value, in a tradition,
Yes.
and the culture, all that keep us together.
Yes.
And keep us liking each other, working with each other, because we have the same issue. Dr. Kumar, we talk about the health. And as you look at the Middle Eastern community, especially the Chaldean, they are all small business.
Yes.
How you could help them with the taxes, with the regulation, with getting a loan from the banks, how you could work with the small business.
Well, Wally, I'm a small businessman myself.
As a, yeah.
As a physician, I run a group of physicians. We have a corporation,
Oh, I see.
Yes.
Yeah. Uh-huh.
and I also own a surgical center.
I see. Uh-huh.
And so, actually, at the surgical center, we provide services, the same services that cost in the hospital 10 times more.
Oh, yeah.
And guess what? Another connection is with the Chaldean community, is also my surgical center.
Yeah.
Because a number of the Chaldean community members who are small businessmen,
Uh-huh.
they don't necessarily have insurance.
Yes.
And so I would say, okay, don't go to the hospital. It's going to cost you $15,000. In $1,500, we can do it at the surgical center.
Wow.
And I took care of a number of people with cancers and others too.
That's good.
But going back to small business.
yes.
Small businesses are the backbone of this country. You know it.
Absolutely.
Okay.
Yeah.
Small businesses, how do we run? We operate on small margins,
Yes.
but we have everything accountable. We are responsible. We take care of everything ourselves.
Mm-hmm.
But we can't then afford to waste too much money. We don't have. So our
Absolutely.
taxes have to be low.
Yes.
And that's what I would do. Small businesses, we would reduce taxes.
How you reduce it? Tell me, because that's important to the community.
Well, see, one
I
of the
mean,
things is
you know.
business taxes that we have levied.
Okay.
We need to get rid of them.
Okay.
We have taxes that are levied on us for our certifications. Especially with the medical businesses, we have to pay taxes for people to come in and check regulations. And a lot of times we feel that those are just made to make money. We need to get rid of so many of those regulations.
Yes.
Its regulations are good. I am part and parcel of saying we have to have some regulations.
Yeah.
Otherwise, what differentiates us from our old countries? Sometimes in the old countries we didn't have any regulations.
Which is mass confusion.
Yeah,
But we
so
cannot.
we do need the regulations.
Yeah, but
we cannot have them over-regulate.
Yes. Yes. Because that costs money that you could save, honestly.
And employ
Yeah.
people.
Yeah. Exactly.
And employ people.
Yeah,
So,
yeah.
so I am for the small businesses.
How about putting a pressure on the banks to easy the relation with the small business by giving the loan? I mean, those banks benefiting from the federal getting all the money and all that, so they have to pass it to the small business, because if they pass it, the small business is the one that could move the whole economy.
Correct, exactly.
Yes. Yeah.
The banks are the bank robbers. Sometimes. There are friends also.
Yes. Uh-huh.
When the TARP came out, the
Yes.
banks had a lot of money.
That's right. Yeah.
But they wouldn't give the small businesses loans.
See, this is the problem.
When in Congress, I would fight for it.
Good.
Make it easy, cash flow, capital.
Yes.
We are a capitalistic society.
Absolutely.
Unless we have capital, we cannot grow.
Yeah.
And we have to make it easy.
Yeah.
So I would definitely fight for that.
That's great. Another issue is immigration. And of
Yes.
course, to every ethnic minority, immigration is important. We are against illegal,
Yes.
but we are good for legal. You know,
Absolutely.
I mean, we there, for example, if you look at the Indian, the Chaldean, the Middle Eastern, they have a lot of relative brothers, sisters, and they could bring him here and
Yes.
all legally. There is a lot of professional people that they would love to come here. And those professionals, when they come here, each one of them create 4 to 5 jobs. So how are you going to handle the immigration issue?
Well, number one, you mentioned already, legal immigration is the strength of our country.
Absolutely.
For centuries, America has been built on the strength, the brains, and the brawn of immigrants.
Yes.
We have to, now illegal immigrants that come in here are also needed. But the poor people have to come through because our visa systems are not that open.
Mm-hmm.
What I would suggest is if we need people to work in farms,
Yes.
hard-working people that come in from the other side of
Create
the border,
something for them so they could
Correct.
come. Yeah.
Just like I'll give you the example.
Yeah.
Just like in the Middle East,
Mm-hmm.
Iraq, when it was being developed,
Yeah.
Syria and other countries, Dubai, for example,
Yeah. They brought a lot of.
they brought a
good
lot
people.
of people from India, Pakistan,
Absolutely.
and Bangladesh.
Southeast Asia. Yeah.
Legally brought them up,
Yes.
kept them in nice places,
Absolutely.
gave them good salaries.
Uh-huh.
They worked, they made these countries better. They went back home because they had collected money,
True.
opened up their own businesses,
Yes.
and made that country better too.
Sure.
Legal immigration will help everybody.
True.
So that's what I would do.
Great.
There are laws in this country that say if you're an employer
Mm-hmm.
and if you employ illegal immigrant, that you would be penalized. We are not enforcing them. We need to
Absolutely.
enforce them.
Yes.
Because guess what? If you don't have a job for people, people will not come. No demand, no supply.
That's right.
We need the demand. The demand is there. Get it legally.
Mm-hmm.
So we can do it that way.
Yeah.
The other issue you pointed out, very, very important, that there is some trend to take away the family visas.
Yes.
For us, family is everything.
Absolutely.
You know,
Yeah.
you and I will give our lives to our children.
Absolutely. Yeah.
We are here
And
to
this
make
is
our
the reason
children
we are
better.
here.
That's
Yeah.
right.
Uh-huh.
That we cannot have them happen to take away the family visas. My father lived with me in this country for 20 years.
Mm-hmm.
We took care of them.
Sure. of
We
course.
don't believe in having, our parents suffer
No, we
loneliness
believe
or
in
take care
family
of.
values and.
So he was able to come here
Mm-hmm.
on the visa, and we paid for his insurance, we paid for everything, because we are productive members of society here. So he had a good life,
Yes.
and similarly, brothers, sisters can come in and help the businesses grow and employ more of our local people.
Absolutely, and especially the professional, the engineer, the doctors. We are in need of nurses and doctors so
Yes,
bad.
yes.
We could let them come from different country, and
Yes.
they will contribute so much to the society.
You know that, right?
Yeah.
The Indian subcontinent per capita income is the highest in the country right now.
Wow. Yeah.
And you should also, and our viewers should know, and probably they do, that more than 50% of the startup companies are from those that were born overseas.
Yes.
So see, we contribute a lot.
Mhm. Yeah. Absolutely.
And going on the reverse, more than 50% of the companies that take away jobs were born in America.
Sure.
So we as immigrants have been great
Yeah.
job
Abso-
producers.
Absolutely.
Yes.
Tell me, Dr. Kumar, you're running for election, and it's a presidential election year. How you think that will affect you? I mean, there is a turmoil. We've seen Clinton leading by 15 points, and now it's dead even, and that could change tomorrow. If that will affect your campaign, for example.
Oh, yes, absolutely.
Okay. How would affect it?
Well, the number of voters.
Mhm.
We need our voters to go to vote,
Yes.
right? So if the voter population is stimulated and energized by these debates, for example, tonight is the debate,
Yes.
that they feel that they want a good president and they go out to vote,
Uh-huh.
well, those voters will also vote for me. And it's
Yes.
important for me to have more voters that get out to vote.
I see.
So enthusiasm about the election is what I'm looking for.
So you're looking for a good turnout.
Good turnout.
Okay. Tell me what you've been doing in your campaign to do you have, for example, voter registration drive? Are you recruiting volunteer? Are you doing some fundraising? Tell me more about your campaign.
We have a lot of young people
Okay.
that we have as volunteers.
Good.
As a matter of fact, we have 350 plus of young volunteers.
Wow, that's good numbers.
Yes,
Yeah.
a lot of the Bernie Sanders young,
Uh-huh.
because Wally and I did not mention that I have a great plan for education to be debt free.
Wow.
Yes.
Yeah.
Education is so expensive in our country right now.
Absolutely.
People
Yeah.
who want to go to medical school,
Yeah.
about $250,000, $300,000 debt.
That's right. And if you get loan, he's stuck with it for how
many
many
years.
Yeah.
If you want to become a welder, it'll be $50,000 debt.
Yeah.
A lot of people don't have that money, so they don't do that.
Yes.
So what I have is a plan that if you want to become a welder, for example,
Okay.
and you take $50,000 debt,
Mm-hmm.
when you start to work, that'll become a tax credit.
Wow.
So you
Yeah.
don't pay taxes to your debt.
I see. Yeah.
So instead of paying IRS, you're
Mhm.
going to pay towards your debt.
Toward your debt. Well, that's a great idea.
And
That's a
so
great
how,
idea.
how does
Yeah.
society benefit?
Oh, it benefit a lot. Yeah.
Because for the next 35, 40 years,
Mhm.
you will be paying higher taxes because you're a much better person, much better, much higher salaried person.
And you could afford to go and educate yourself and get a
And
good
your
job.
children and your
Yeah,
family.
exactly. Yeah.
So that is the reason why a number of the young people are attributing their time to us.
Great. Tell me more about your campaign.
So we have also organizers. They're
Uh-huh.
also having coordinated campaigns with the Hillary camp.
Uh-huh.
And so we knock doors, we meet people, give them flyers. We are doing mailers.
Good.
So I'm sure a number of you might have received.
I receive
mailers.
email twice a day from
Yes.
you, every single day.
We're also sending mailers. You'll be starting to receive
Yes.
mailers.
Uh-huh.
We'll be on television.
Mhm.
We're right here with
Absolutely.
you.
And MEA, absolutely. We will
And thank
blast
you.
it.
MEA is
Sure.
a great venue.
Pleasure.
It's been a
Yeah.
very watched
Yeah. Thank you.
show. Thank you so
Yeah.
much.
Sure.
I have been holding also town hall meetings
Good.
on
Yeah.
important issues. The other issue is drug addiction in our country.
Absolutely. And this is getting out
100,
of hand.
130 young people die every day
Yes.
because of drug overdose.
And especially in Michigan, for
In
some
Michigan,
reason,
yes.
in Michigan,
Yes.
we get, and the Middle Eastern community is becoming a tragic.
Wali, that problem transgresses everything. It doesn't care if you're Republican, if you're
Oh,
Democrat,
absolutely, yeah.
doesn't care if you're rich,
Yes.
you're poor,
What religion,
you're
what
black,
the-
you're
what
white,
color,
what
absolutely.
religion.
Yeah.
And it is an epidemic. And we as community have to get on board. Otherwise, 10 years from now, every family will have a catastrophe.
We'll pay a
in their
heavy
family.
price.
So
Yeah.
I have a plan how we can do this program
Excellent.
to prevent
Mhm.
and take care of our children that might be on addiction.
Excellent.
So-
Finally, Dr. Kumar, as I mentioned, I see you a lot with the event in the Middle Eastern community. Do you have a volunteer from this community? Are you going to this community to ask them for their vote, for their support? Tell me more, please.
I have a number of volunteers from our community, but I need more.
You need more.
So, all
what's
those
your
that
message?
are watching
what's your
us,
message? Tell me,
my
give me a
message is
message.
please come out of your homes, call us and join us so that we as minorities can actually join hands
Absolutely.
and become a majority
Mhm.
and serve both America and our communities in a very fruitful way. We are looking forward. We really want you guys to come out.
Well, Dr.
Yes.
Kumar, thank you for coming here. Good luck with your campaign. And I know the community will support you because you've been supporter of this community for a long time. So
Love to do it.
absolutely, it's their turn now to come and support you and vote for you and support you, not just for the vote, for the money too.
Yes, thank you so
Yeah.
much, Wally.
Thank you very
And
much.
Pleasure and an
Sure.
honor.
Thank you.
Honor to be here. Thank you, Wally.
Dear reviewer, that was my interview with Dr. Kumar. He's running for U.S. Congress, 11th District. And Dr. Kumar, I know him for a long, long time. He's been with the community. Even before he thought about running for office, he's been with the community. He served the community. He's becoming part of us when we get together. So I'm asking you now to return that favor. You know, when he came to you, he didn't ask you for a favor. No, he did it from his heart. So I want you to do it from your heart too, to come and support him with money and especially with vote. So join his campaign. We're going to put the phone number or the website in the bottom so you could call him and join his campaign and help him winning the election, because honestly, a person like Kumar, if he won the election, is win for all of us, for all the ethnic minorities, and for all the good people that looking as Dr. Kumar for their family to come here and better a future for their children. Thanks for watching and good night.